Hello, I'm Dr. Lewis with Spinal Health and Nutrition. Today, I'm going to go into more details on how to address a patient that is having or suffering with lower back pain and neck pain. If you look at my last video, I just went through some simple techniques on how to solve someone's problem that's having sciatica, the lower back and neck area, okay? Remember, I have my spinal model here. You got the bone, you have the disc, the spinal cord, and the nerves. This is the disc. So when the disc comes out, it's a bulging disc. When it comes too far out, as you see here in this illustration, that is a herniated disc. Okay, so what I have here is this table. One of the best tools that I have in the office, this is called a spinal distraction table. And this is a very good alternative if someone doesn't want to have any spinal injections done, surgery, or any invasive type of treatment. This is a very simple device that I have here. It's good for someone that has a wear and tear or degenerative disc, bulging disc, herniated disc, facet syndrome, and scoliosis, okay? So it's a very simple device that I have. The way I set this up is that I would have the patient simply lay down on their stomach, okay? Their feet and ankles will be right here. There are some straps at the end of the table that goes around their ankles so that when the table distracts, it can be able to pull their lower back and the hip and lower back area, all right? So they're gonna lay down their stomach. I bring this part up right here. And some of my control panels are here. To get the table started, I turn it on right here. Okay, so I had a patient lay down. While they're laying down, first thing I do, depending on when they notice their herniated disc and bulging disc, if it's in the acute stage, meaning that the injury had just occurred a couple of days ago with some swelling, I put an ice pack on the lower back or neck area. All right, the way I turn this on, I always set my timer for about 12 minutes, 12 and a half minutes, and then he start. And as you can see, that the table is basically set on auto. It's slowly distracting the lower back. So what it's basically doing is that it's decompressing the disc by taking pressure off the nerve, okay? And also opening up these joints right here called the facet joints. All right, remember the last video, whenever someone has an issue with the facet joints, they will have dull, aching pain on the lower back. Sometimes it travels from the lower back to the back of the leg. It's also good to eliminate waste that builds up around the herniated or bulging disc, okay? So this technique is a very good technique. It's a very slow healing process. So the first time someone will use this table, they're not going to feel good right away. It's going to take time. But over a period of 10 to 12 weeks, they will start feeling better, all right? So after the timer goes off, the table will stop on its own, okay? So then I'll come in and do what we call manual joint and disc pumping. So while they're laying down on their stomach, I just relieve this dial right here. And I place one hand on their lower back, and I slowly bring the table down and up, down and up, just like that. Down and up, all right? If the patient has scoliosis, all right, I relieve this portion right here, and I just slowly bring the table this way, just like that. Slowly bring it that way. So I look to see which side is more restricted or they have less range of motion, they have a scoliosis. If it's on this is the side I'm gonna be working with. And I go back to doing my joint and disc pumping when I bring the table down and up. Same thing on this side right here, okay? So then we have the neck region, also known as the cervical region. Patient is still going to be on their stomach. The head is going to be here. What I have here are these straps. The straps will go around the back of their head, right back here. All right. Then I will bring this part up. just like that. Okay. So this is my panel right here to control what I'm doing when I'm treating the patient. All right. So once again, if they're having bulging disc, herniated disc, while they're laying on their stomach, I just simply and slowly distract the head and neck going this way to stretch out the disc. Very slow. Just like that. Okay. Then I also do, once again, the joint and disc pumping. So I leave this part here, simply go down and up, just like that. Slowly and up. Okay. All right. Very simple procedure. Okay. So once again, after the patient is done using this table, chances are they're going to be sore because their body is just adjusting to this particular technique here. I always tell my patients, when you go home, ice down the lower back, ice down the neck area for 20 or 30 minutes to help reduce the inflammation that builds up when we're going through a whole lot of stretching on this table. All right. And once again, it's going to take time. Research shows that when a patient uses this table, they have a 40 to 50% reduction in pain when they're using this particular device. Okay. And as long as they stay consistent with their care plan, getting on this table at least 3 to 4 times a week for another 10 or 12 weeks, they are going to have some improvement on their lower back and neck area. Very simple. Like I said, it doesn't require any extensive amounts of surgery, spinal injections, portable steroid injections that will have those side effects. All right. So this is all I have for here. Okay. Very important to follow the proper protocol, proper care plan in order for this thing to work. I'm Dr. Lewis. Please subscribe and remember, your health is your greatest investment.